Today, we have a very practical topic, the home veterinary first aid kit. What do you really need, and when is it time to see the vet? My name is Polina Vladimirovna Kuvshinova. I'm a veterinarian with 20 years of experience and many years of hands on work in leading veterinary clinics in Moscow. Emergencies always happen unexpectedly. And in that moment, the hardest thing for the owner isn't the situation itself, but the confusion. What should you do? Where should you go? What's allowed and what's not? Do you need to rush to the vet or can you just observe for a while? The main rule is do no harm. In veterinary practice, there are often situations where the vet has to deal not only with the injury or acute condition, but also with the consequences of incorrect help that the pet's owner tried to provide at home. And most often, this doesn't happen out of indifference, but on the contrary, out of a desire to help as quickly as possible. But it's in these moments that it's especially important to understand the line between helpful first aid and actions that could make your pet's condition worse. Animals aren't people, and a familiar everyday situation for us can play out very differently for them. Don't give your pet human medications unless specifically prescribed by a veterinarian. A home first aid kit is for first aid only, not for self treatment. Our job isn't to treat at home, but to do just enough to safely get your pet to the vet. All sorts of unpleasant things can happen to your pet in everyday life. Your pet might cut its paw during a walk, get a burn or injury, be bitten by an insect, overheat, or feel unwell after eating something off the street. Let's go over the most common everyday situations and figure out how to respond correctly in each one. The first thing your first aid kit should have is contact information. In a stressful situation, we all tend to think less clearly. And when your pet is in trouble, searching for the clinic's phone number in your messages, notes, or bookmarks is the last thing you want to waste precious time on. What's more, it's not uncommon for the person who usually takes care of the pet and keeps all the important contacts to be unavailable when you need them most. And then the rest of the family just freeze up, not knowing who to call, where to go, or what to do. The second thing you should keep with your first aid kit is documents. Your pet's passport, important prescriptions, discharge summaries, and the results of recent tests. If you have these, it's best to store them all together in one clear and easily accessible place. You don't have to carry all of this with you every day, but at home, these documents should be organized so that you don't have to search through different folders and drawers when you need them. Your first aid kit should always include blunt-ended scissors so you don't accidentally hurt your pet, and a thermometer. That is, a thermometer, preferably a digital one, dedicated just for your pet, ideally with a soft tip, and keep some petroleum jelly or another safe lubricant nearby for taking their temperature. Why is this important? Because just thinking, I feel like they're hot, isn't a reliable indicator. Temperature is one of those things that really helps the vet determine how urgent the situation is. What should you use for scrapes, cuts, and active bleeding? For scrapes, shallow cuts, or superficial skin injuries, the main task for the owner is to gently clean the wound and cover it with a sterile material. If the bleeding isn't severe, stop it and secure the bandage. In this situation, you can use disposable gloves. Use 0.9% saline solution for rinsing, a hemostatic sponge or hemostatic dressing to stop the bleeding. Sterile gauze pads, bandage, non-stick wound pad, and a self-adhesive bandage to secure the dressing. First, gently rinse the injured area with saline solution. If the injury is minor, superficial, and without significant bleeding, place a sterile gauze pad or a non-stick pad on the wound and, if necessary, secure it with a bandage. If there is bleeding, use a hemostatic sponge or a hemostatic dressing. You can use a bandage on top to secure it. It's important not to pour alcohol-based products, concentrated antiseptics, or iodine onto the wound, as these can irritate the tissue. The goal here isn't to cauterize the wound, but to gently clean and protect it. If the bleeding is severe and won't stop, the blood is flowing heavily, the wound is deep, and your pet is becoming lethargic and weak. This is already a situation where you shouldn't just watch at home, but urgently take your pet to the clinic. It's also important to remember that if the bandage you're using is already soaked with blood, you shouldn't remove it. Instead, apply another layer on top. Removing the first layer can disrupt the forming clot and make the bleeding worse. To reduce bleeding, the focus should be on applying direct pressure to the wound, putting on a pressure bandage, and getting to the vet as quickly as possible. If a capillary is cut while trimming the claws and bleeding starts, your home first aid kit should have a styptic powder or a styptic pencil for this kind of situation. First, apply direct pressure to the claw with a tissue or gauze, and then use a styptic agent. The next situation we'll discuss is heat stroke. Hyperthermia is an acute, life threatening condition for your pet that requires immediate action from the owner. In dogs, heat stroke usually presents very noticeably with severe panting, labored breathing, excessive drooling, changes in gum color, weakness, disorientation, vomiting, and in severe cases, seizures and loss of consciousness. Cats can also suffer from heat stroke, although it is less common. In cats, it can manifest as rapid breathing, open mouth breathing, lethargy, pronounced restlessness, and a rapid decline in condition. For a cat, open mouth breathing by itself is already a serious warning sign. If you suspect heat stroke, the main rule is very simple. Your task is to start safe cooling immediately without wasting any time, and at the same time, arrange for your pet to be taken to the clinic as quickly as possible. Heat stroke is not something you can just wait out at home. Even if your pet seems to feel a little better, internal complications may still continue to develop. The consequences of hyperthermia can appear within 24 to 72 hours. This happens very often. You need to move your pet to a cool, well ventilated area, ideally one with air conditioning. Dampen their fur with cool but not ice cold water. Pay special attention to the neck, armpits, belly, and groin. Your goal is to cool your pet down gradually. Rapid cooling can cause an immediate shock reaction. Do not use ice or ice cold water. This causes blood vessels to spasm and will slow down the cooling process. Place wet towels on your pet's body, changing them every 5 minutes. Offer water. Moisten their nose and lips with cool water. Do not force water into your pet's mouth. Water could get into the trachea and lungs. This is very dangerous. Take their rectal temperature, keeping in mind that the normal range is 38 to 39.2 degrees Celsius. Even if your pet seems to be feeling better, take them to the veterinary clinic immediately. Heat stroke can cause kidney and liver damage, brain swelling, and DIC syndrome. Continue cooling your pet during the trek. What should you not do? Do not give fever-reducing medications, immerse your dog in ice-cold water, drastically lower their body temperature, leave them unattended, or hope that it will just go away on its own. Never leave your pet in the car, even for 5 minutes. At just 24 degrees Celsius outside, the car interior can heat up to 50 degrees in 10 minutes. Keep this in mind. Do not leave your pets in an unventilated room during the summer. And remember, brachycephalic breeds like pugs, bulldogs, and other brachycephalics, as well as elderly dogs, are at especially high risk. What should you do if you suspect your pet has been poisoned or eaten something harmful? Here, it's important to distinguish between two different situations. When we say the pet ate something and started feeling bad, in practice, this phrase can refer to completely different situations, and it's important for the owner to understand the difference. The first situation is toxic or chemical poisoning. That is, the pet came into contact with a substance that was never meant to be ingested or is dangerous in and of itself. Household chemicals, medications, insect and rodent control products, fertilizers, cosmetics, automotive fluids, plant toxins, and other potentially toxic substances. The second situation is when a pet eats something inappropriate, spoiled, or questionable in quality, but of biological origin. Stale food, table scraps, something rotten, or carrion. On a day to day level, pet owners often lump all of this together under one word: poisoned. But from the perspective of first aid logic, it's not exactly the same thing. In the first case, our main concern is the possible effect of a toxic substance, and we act as if it's a potentially dangerous intoxication. If there's any suspicion of contact with a toxic substance, this is not a situation where you should wait and see what happens next. Poisoning may start with mild symptoms, but then the condition can deteriorate very quickly. In dogs and cats, warning signs can include vomiting, diarrhea, drooling, lethargy, unsteadiness, tremors, seizures, collapse, And with some substances, skin irritation, burns on the mucous membranes, or breathing problems. You need to gather as much information as possible. What was the substance involved? About how much did your pet eat or lick? When did this happen? What is your pet's weight? Have any symptoms appeared yet? If you still have the packaging, ingredients list, a photo of the label, or any leftover substance, you should bring it with you, or at least take a picture of it. If you suspect poisoning by toxins, contact your veterinarian immediately and let them know you are bringing in your pet with suspected toxic poisoning. What should you not do? Do not try to induce vomiting yourself, and do not give eggs, oil, milk, or any other home remedies. Do not give human medications or any sorbents. In cases of toxic poisoning, these remedies can be useless, and sometimes trying to give them at home only wastes time or increases the risk of complications. If the substance got on the skin or fur instead of being ingested, the first thing to do is rinse it off the skin and fur with plenty of water, using mild soap if necessary, and prevent your pet from licking itself. After that, contact the clinic. In the second case, it's usually about food poisoning or digestive upset, although this kind of situation can also be very serious. If your pet ate something spoiled, rotten, or just not suitable in quality, we usually think of food poisoning or an acute gastrointestinal disorder. In this situation, the goal of your home first aid kit isn't to treat your pet with random medications, but to help during the first few hours. Remove food, make sure your pet has access to water in small amounts, monitor vomiting, stool, and overall condition, and after vomiting stops, if needed, switch to a gentle diet in small portions. Absorbents should be given with caution and only if prescribed by a veterinarian. If vomiting continues, diarrhea worsens, blood appears, your pet becomes lethargic, refuses water, or looks unwell, this is no longer a situation for home monitoring. In such cases, you need to get to a clinic as quickly as possible because similar symptoms can hide much more serious conditions. If we realize that the animal has swallowed a foreign object, this is a separate and very important situation because it's one thing if your pet ate something spoiled and gastrointestinal symptoms come to the forefront. And it's a completely different story when we know that a foreign object was swallowed: a sock, part of a toy, tinsel, a piece of rubber, a fragment of plastic, a string, a bone, especially a tubular one, or any other item that isn't meant to be swallowed. You need to act depending on exactly what was swallowed, its size, and how potentially dangerous or traumatic the object might be. Situations that require urgent medical attention are those where large objects have been swallowed, which are very likely not to pass further through the gastrointestinal tract. Objects with sharp edges, tubular bones that can injure tissues, linear objects, strings, ropes, ribbons, multiple magnets, batteries, objects that can swell, get stuck, or break apart into hazardous pieces. Large indigestible objects, when they enter the stomach, can cause obstruction, blockage of the stomach exit, trauma, or gastric volvulus. These conditions are extremely dangerous and require immediate veterinary assistance. If your pet is already showing symptoms such as repeated vomiting, unproductive retching, abdominal bloating, lethargy, abdominal pain, refusal to drink or eat, weakness, restlessness, and inability to get comfortable, these signs are considered alarming and require an urgent veterinary examination. If the object was small, soft, not sharp, and singular, and the animal is feeling generally well, there's no vomiting, no signs of pain, no bloating, and no overall deterioration, then in some cases, the veterinarian may recommend monitoring. This means you need to watch your pet very closely and be ready to go to the clinic at the slightest sign of trouble. The proper way to monitor at home is as follows. Don't give any food until the situation becomes clear and there's no longer a risk of needing veterinary intervention. Don't try to induce vomiting yourself unless a veterinarian has specifically recommended it. Make sure your pet has access to water, and don't give any medications, laxatives, or oils on your own. Carefully watch for any signs of worsening condition. Some home advice suggests giving your dog petroleum jelly, mineral oil, or castor oil, but these remedies are not considered standard or safe first aid. When a foreign object has been swallowed, these methods won't solve the problem of the object being stuck, and in some cases can actually increase the risks. Here's another dangerous situation at home. Your dog gets into a big bag of food and overeats. In reality, it's not at all harmless when a puppy, a young dog, or a large breed with a greedy appetite gets into a bag of food that's been left out in the open. When the stomach is severely overfilled, there's a risk of serious stretching, significant stretching, vomiting, bloating, and in some dogs, gastric torsion. Gastric torsion is an emergency, life threatening condition that requires immediate veterinary attention and, as a rule, emergency surgery. If after overeating or during bloating, your dog's abdomen becomes enlarged, they have unproductive retching, pronounced restlessness, pain, weakness, or their breathing worsens, every hour counts. In this situation, you need to get your pet to the clinic immediately because with gastric torsion, treatment requires urgent stabilization and, as a rule, emergency surgery. The next important topic is the eyes and how to care for them safely. The eyes are a very sensitive area. Home eye care is only acceptable when it comes to minor contamination or routine hygiene. If there is pain, squinting, pronounced redness, inflammation, thick discharge, or an injury, this is no longer a case for home care, but a reason to take your pet to the vet. In dogs and cats, warning signs include squinting, frequent blinking, redness, swelling, sensitivity to light, and cloudy yellow or green discharge. In cats, the partial or complete appearance of the third eyelid is especially concerning. For a home eye care kit, it's enough to have sterile 0.9% saline solution or a ready-made sterile eye wash, sterile gauze pads or soft lint-free discs, and if needed, veterinary wipes for cleaning the area around the eyes. If a speck, dust, sand, or fur gets into the eye, the main thing for the owner is not to try to mechanically remove the foreign object. The safest action is to gently rinse the eye with sterile saline solution. After talking about eyes, it makes sense to discuss ear care. The situation with ears is a bit different. While we usually just gently clean the eyes at home, some pets really do need regular ear care. But it's important to remember cleaning the ears is a hygiene procedure, not a treatment. If the ear is red, painful, has an odor, there are discharges, or your pet is scratching it a lot, you need to see a vet first, not just clean it at home. For ear care at home, it's enough to have a good quality veterinary ear cleaning lotion, cotton pads, and gauze wipes in your first aid kit. It's not recommended to use cotton swabs because they can injure the ear canal and push debris deeper inside. Don't use products with peroxide or alcohol for home care, especially if the ear is already irritated. The next situation that's important to discuss is insect bites and stings. Most often, we're talking about bees, wasps, and bumblebees. In most cases, it only results in local pain, redness, and swelling. But sometimes the reaction can be severe, and in rare cases, anaphylaxis can develop. That is, a serious systemic allergic reaction that requires immediate veterinary care. In dogs and cats, stings usually cause pain, localized swelling, and itching, but in severe reactions, there may be difficulty breathing, weakness, and shock. If you see that your pet has been stung by a bee or wasp, the first thing you should do is examine the sting site. If it was a bee, the stinger may still be there, and it should be removed as quickly as possible. After that, apply a cold compress or an ice pack wrapped in cloth to the sting site for a short time to reduce pain and swelling. For a single sting and a mild local reaction, this is often enough as first aid. What should you not do? Do not rub the sting site. Do not give medications just in case without consulting a veterinarian. Do not wait too long if the swelling is rapidly increasing or if a general reaction appears. Antihistamines are indeed used in veterinary practice, but they're not first aid for anaphylactic shock and do not replace emergency treatment. For anaphylaxis, the first line drug is epinephrine, but that's already a matter for emergency veterinary care, not home self treatment. Antihistamines and steroids are considered additional measures, not the main life saving treatment in cases of shock. Go to the clinic immediately if, after a bite, your pet's facial swelling increases rapidly, their lips, eyelids, or tongue swell up, they have difficulty breathing, start vomiting, experience sudden weakness, or become unsteady. Your pet becomes lethargic, pale, collapses, or loses consciousness. These are already signs of a severe systemic reaction, and at this point, every minute counts. In cases of anaphylaxis in dogs and cats, veterinary assistance must be immediate. Try to avoid walking near beehives. If you see a wasp nest in a tree, leave the area immediately. Don't feed your pets sweet fruits and vegetables outdoors. Bees, wasps, and other insects may be attracted by the smell and could sting. It's worth talking separately about flea and tick prevention. For this, drops, collars, tablets, and sprays are used, but the product should always be chosen specifically for your pet. It's especially important to remember that some products that are safe for dogs can be toxic to cats. Fleas aren't just unpleasant parasites, they're a real problem for your pet's skin and overall health. They cause itching, skin inflammation, can lead to flea allergy dermatitis, and in cases of severe infestation, even anemia, especially in young and small animals. In addition, fighting fleas always involves not just treating your pet, but also addressing the environment, because eggs and larvae are found not only on the animal, but also in your home. For the prevention and treatment of fleas, various forms of medications are used in international practice: spot on drops, tablets, oral medications, collars, and sprays. Keep in mind that not all flea and tick treatments are equally safe for dogs and cats, so the medication should always be chosen based on the type of animal, its weight, and age. Never use products intended for dogs on a cat unless this is specifically stated by the manufacturer and your veterinarian. Ticks are dangerous not only for dogs but for cats as well, so all pets need protection. They can injure the skin on their own, may cause inflammation, and most importantly, they transmit infections and, in some cases, toxins. To protect against ticks, spot on drops, collars, tablets, and sprays are used. It's also helpful to regularly check your pet's fur after walks and to quickly remove any attached ticks if you find them. If there are ticks in your area, I recommend getting a special tick removal tool for your home first aid kit. They're very convenient to use. If you find a tick, you should remove it as quickly as possible with a special tick removal tool, trying to grab it as close to the skin as possible and without squeezing its body. After removal, you can gently rinse the bite area with saline solution or carefully treat it with a mild antiseptic suitable for animals. There's no need to aggressively cauterize, pour alcohol on, or apply anything to the bite unless absolutely necessary. After the tick has been removed, it's important to monitor the bite area over the next few days. Watch for any redness, significant swelling, pain, or discharge. Keep an eye on your pet's overall condition. Remember about prevention. If your dog becomes lethargic, refuses to eat, or develops a fever of 103.1 degrees Fahrenheit, 39.5 degrees Celsius or higher, if the color of the urine changes, turning dark brown or reddish brown, if the mucous membranes become pale, or if there is muscle weakness or decreased tone in the hind legs, these symptoms can be signs of babiosis or pyroplasmosis, infectious diseases in dogs caused by tick bites. At the first sign of these symptoms, you should immediately contact a veterinary clinic. Without specialized treatment, the disease can be fatal. And finally, let's briefly go over the most common mistakes. The first mistake is giving pets human medications. We've already talked about this, but it's such a common problem that it's worth repeating again. The second mistake is wasting time. Sometimes that's actually acceptable, but in an emergency, losing time is the main mistake. The third mistake is panicking. When an owner gets scared, they start doing way too many unnecessary things. But when it comes to first aid, what's important isn't just being active or fast, but staying calm and following the right steps. And of course, lack of preparation. When you only have a first aid kit in theory, but in reality, nothing is put together. The clinic's number isn't saved, there's no thermometer, the bandages are gone, and you have to look for what you need right when your pet is in trouble. A home veterinary first aid kit isn't about expecting disaster or being overly anxious. It's simply part of calm, responsible care for your pet. It doesn't replace a veterinarian. It doesn't make you a specialist, but it gives you what matters most in an emergency: a little extra time, a bit of support, and the ability to act calmly and safely. Thank you for caring for your animals thoughtfully and responsibly. And I wish good health to you and your beloved pets.